and to get them the equipment that they need.
So a stark acknowledgement of some of the challenges from the Community Secretary yesterday. And this shipment today, will it be enough? Let's speak now to Niall Dickson, who's Chief Executive of the NHS Confederation. They represent organisations which provide services to the NHS. And we can also talk to Dr Tom Dolphin from the British Medical Association. Morning to both of you. Niall Dickson, first of all to you. This 80+ tonnes of equipment coming from Turkey, we're told it includes something like 400,000 gowns. Is that going to be enough? What kind of difference will it make?
Well, it's a few days' supply, so it may be enough to avert an absolute crisis over this weekend, but it doesn't solve the longer-term problem. And the question really is, how guaranteed are we that we will have similar shipments over the next few weeks? And then will there be, from May onwards, a really guaranteed regular supply so that we take away the levels of fear and anxiety which are existing in hospitals, but also, crucially, in GP services and communities and social care as well. So it's across the whole health and care system that at the moment there's a supply problem and there's a confidence problem, because the levels of fear and anxiety have risen over the last few days. I understand why the government issued this emergency advice about what do you do when you run out. I don't think they had much alternative but to do that. But the reality is that will have again knocked the confidence of an awful lot of NHS staff who are faced with a situation when they're going into work where they may feel they haven't got the level of kit that they need. And I hope these extra supplies will get us around that, get us over the next few days, but we will be looking to see, once this supply has been used up, as it were, there needs to be other regular shipments.
Tom Dolphin, Neil there talks about increasing levels of anxiety around healthcare workers. Are you seeing evidence of that? And should we have seen this supply problem coming?
Absolutely, we could have seen this coming. We've had warnings for several months that this was coming. We've had warnings from exercises that were done before, looking at what we should do about a pandemic several years ago. So this is definitely something we could have planned for better and executed those plans better. What the BMA is seeing, what we're hearing from our members nationally, is that although it's got very slightly better in some ways, broadly there are still big shortages. We've still got something like a third of doctors finding shortages getting the FFP3 masks, the tight-fitting face masks. This is a respiratory illness. This is a disease you breathe into your lungs, and that's where it affects you. So to see that many doctors and nurses and other healthcare workers still unable to get those masks, it's just unacceptable.
Dr. Tom Dolphin, I wanted to ask about the fact we might take PPE for granted. We think we know what it is for and how it is used, but maybe give me a sense of what you use day to day, how you use it, and why it is so important.
Well, broadly speaking, there are two different kinds of PPE you would use in a hospital. There's the type that you use for the highest risk settings, and then there's a type that, for example, intensive care or the operating theatres. And there's the type that you would use on a ward for patients who are not on a ventilator, patients who are not on CPAP, the tight-fitting oxygen masks. And for the high-risk areas, you need to have, as I say, the tight-fitting FFP3 masks, you need eye protection, you need gowns that cover your sleeves, and of course you need gloves and shoe covers as well often. So it's quite a high level of protection. The guidance that's been put out this week, at the end of this week, which reflects these shortages, somehow wasn't good enough last week, and yet somehow we're expected to think it's good enough or acceptable this week. It really isn't. If the government thinks that these levels of protection they're now recommending are okay, then they're very welcome to come and join us for a shift and see how we all get on breathing the same air together.
We're talking about, Niall Dickson, aren't we, the reusing of gowns. Can you see in some circumstances where that may not be ideal but acceptable?
Well, I think it's certainly not up to me to start telling doctors and nurses what is or is not acceptable. What I think needs to happen is, first of all, we have to pray that we do not get into a situation where people are going into clinical areas without the protection that they need, and that is why these extra supplies are so important. If in a hospital people do find themselves in a position where they're falling back on the so-called emergency advice, then I think it's a question, first of all, for a discussion between unions, professional organisations and management at local level with the medical experts there about what they've got and is that acceptable going in. And then I think it is a matter for each individual member of staff then to make a decision around that. I really hope that this does not happen, or it happens in a vanishingly rare number of cases. But there's no doubt that at the moment the levels of concern and worry are very high. We are living hand to mouth. We are finding that hospitals may have enough now, but they're thinking, well, we'll run out by 11 o'clock tomorrow morning, which is the kind of comment that I've had, where shipments arrive and they were expecting 800 pieces of equipment, or a particular piece of equipment. Instead, they only have 400 pieces, so that lasts them for a shorter period of time. So I don't want to underestimate the kind of fear and anxiety across all leaders and people on the front line around this. But I think that what needs to happen is that if there isn't enough stuff, it needs to be a matter that is then discussed locally. There is the guidance there. I think the guidance in that sense is helpful, showing what possible alternatives there may be. But then the ultimate decision, I think, has to be for the individual member of staff, in consultation, obviously, with the experts within that institution.
Tom, I can see you nodding along to this, and I'll come to you in just a moment. But, Neil, I just want to pick up on some of the logistics of getting this PPE to the places that it is needed most. Because we know there's a long supply chain. It's not necessarily easy to get hold of, given the demand. And then getting it to the UK and to the hospitals is proving to be much harder than many would appreciate.
Yes, it is, and I mean, I'm not speaking for the centre, but I do believe, and I think there is a justifiable question about how well prepared we were, what sort of supply chain did we have in place, those kind of questions. I do think those are ultimately questions for after this period. What we need to do is get it right now. I think everybody at the centre within NHS England, within Public Health England, and the other bodies around the UK are stretching every sinew to try and do this. We've got people trying to buy this stuff all around the world. We have got a bit of a perfect storm. I think the original planning was for a flu pandemic, which would not have required the kind of numbers in terms of gowns that we are requiring for COVID. Question, should we have planned for something different than we did? But also, we've got a perfect storm in the sense that the biggest manufacturer of this stuff is China, and China went into lockdown and stopped manufacturing. It's only now picking up. And of course, at that moment, the whole world wants this stuff. So I think we need to do everything possible to try and get this. And as I say, we have concentrated on hospitals rightly around the gown issue, but there are real questions for GPs, for care homes. You've heard that on the programme this morning, where staff really are putting themselves at risk, likewise at mental health institutions and across community services in general.
And Tom Dolphin, if I can ask that about staff putting themselves at risk, we've had the Royal College of Nursing come out and say they don't think that nurses should treat patients if they don't feel they are given adequate protection. Have your members been reporting similar dilemma about whether they are really fit to practice?
Well, of course, no doctor or nurse wants to be put in that situation. When you join the profession, you expect some exposure to infectious disease. Of course we do. But what we're being asked to take now are unnecessary risks. We shouldn't be being put in this position. The BMA, like the Royal College of Nursing, has been very clear that doctors who are put in this position where they're being put in danger by being asked to see a patient without the right equipment do have the right to say that they won't do that. And if they do make that decision, which no doctor wants to do, then the BMA will back them up. But what we really want is just to have the PPE there so we can get on with seeing our patients without fearing for our own lives.
Thank you very much for your time, both of you. Tom Dolphin there, consultant anaesthetist and also representative of the BMA. Thank you very much also to Niall Dickson, Chief Executive of the NHS Confederation.
Well, let's stay with that theme, because it's been announced that London Olympic boss Lord Paul Dayton has been appointed to help get more PPE to NHS staff. So let's speak now to Kate Hills, who represents a group of manufacturers who are in